My name is Carolina Ramos. This is my presentation, Advanced Practice Registered Nurse Consensus Model. Advanced Practice Registered Nurse, better known as APRN. This is registered nurses that have completed either a master's or doctorate level program that is specifically geared towards a certain population, and they can assess, diagnose, and treat patients. This includes ordering tests and medications. All programs completed, either master's or doctorate level, must be accredited through the CCNE, Commission on Collegiate Nursing Education, or the ACN, Accreditation Commission for Education in Nursing. This is due to making sure that the programs are up to the educational standards, that they meet the standards required to be able to test nationally for the APRN exams. APRNs can subspecialize into specific specialties after completing whichever population they went to, and you can subspecialize. There's orthopedics, cardiology, oncology, nephrology, urology, palliative care, and there's much more that they can do as well. So there's 4 major roles before subspecialties that are considered advanced practice registered nurses. The first one we're going to discuss is nurse midwife. Nurse midwives, they offer their services specifically to women throughout the lifespan, and these services include gynecology care, family planning services, preconception care, prenatal and postpartum care, childbirth, care of the newborn. They're also allowed to treat the partners of females, so males, even though they're not really geared towards males, but they can treat them for like STIs, any type of infection that is related sexually to the female, the woman, the biological woman. How to become a nurse midwife? First of all, you have to be a registered nurse. You have to have completed either a master's or doctorate level degree in nursing with a midwifery focus. So these programs are geared specifically for midwifery content, and that is their main focus. And obviously the program must be accredited, as we had spoken of earlier. And then the student has to pass the National Certified Nurse Midwife certification. The second role out of the 4 is certified nurse practitioner, and this is very commonly known and is probably one of the most popular out of the 4 specific roles. They're also just known as NP, nurse practitioner. So this offers advanced health promotion, disease prevention, health education, counseling. They diagnose and manage acute and chronic diseases. They usually offer services to 6 populations. This can be family practice, and this is where they specialize in the care and treatment of patients from birth until old age and death. You usually see this in doctor's offices, sometimes nursing homes, or even hospitals, but they're mainly used in clinics or immediate and urgent care. They can be used in a wide variety of things, but they're mostly used in primary care clinics. There's pediatric nurse practitioners, and they certify in specializing in providing primary care for infants, young children, and adolescents, and they go up to the age of 21 years. And then after that, it would have to go to family practice. There is neonatal. Neonatal nurse practitioners specialize in the care and treatment of preterm and full-term newborn infants throughout the first years of their lives. So continuing with the nurse practitioner roles, they can also specialize into geriatric population, and this specializes in the care and treatment of elderly patients. You'll mostly find these type of roles in nursing homes specifically, or long-term care facilities, skilled nursing facilities. Psych and mental health. They specialize in assessing, diagnosing, and treating the mental health needs of patients from childhood to old age. There is also women's health and gender-treated populations. They specialize in the care and treatment of primary health care services to women of all ages, generally speaking of adolescence and continuing through pregnancy and menopause. And this is a little different from midwifery because midwives are they can do all of this as well, but they're mostly geared towards the birthing process. As women's health, they're not obstetrics. They're not involved in the actual birthing process, but they can provide care prenatal and postpartum as well. And then these subcategories can either be acute care or primary care, and some programs do let you go into acute care, like an acute care primary nurse practitioner, but this is more depending on the school, and you have to pick the program that you want, and it has to be specially geared towards this. How to become a certified nurse practitioner? You must be a registered nurse. You must complete either a master's or doctorate level program that is accredited. You must pass the national exam for the population that you studied for. And then there's different ones. There is the National Certification Corporation for Neonatal Nurse Practitioner, Women's Health Care Nurse Practitioner, the AANP or the ANCC for Adult Gerontology or Family Nurse Practitioners, ANCC for Psychiatric Mental Health, and then the CPNP for Primary Care Pediatric Nurse, and then you can also do the PNCB. So there's different ones that allow for each specific role. So you do have options if you don't want to do one exam. If there's another one available, you are able to choose, and it is preference for the student. The third role we're going to speak of is clinical nurse specialist. And this is one I wasn't too versed in, so this was interesting for me to learn. Clinical nurse specialists are also considered advanced practice registered nurses, and they are actually able to diagnose, treat, and prescribe medications just as any other APRN. Their focus is a little different. Their focus is mainly on administration and research rather than direct patient care as in certified nurse practitioners. And it was found that their role is mostly 67% clinical, 21% administration, 6% educational, 4% research, and 2% consultation. So most of their work is kind of behind the scenes helping the team in more of a hospital setting than direct patient care. And this is done during advocacy, advanced evidence-based research, and collaborating with the team as an input to help the patient's health. How to become a clinical nurse specialist? So you must first be a registered nurse, complete either a master's or doctorate level program in nursing that is accredited, and then you must pass the Certified Clinical Nurse Specialist certification through the ANCC. The fourth role is Certified Registered Nurse Anesthetist. They're also known as CRNAs, and it is an advanced practice RN that provides anesthesia and anesthesia-related care for individuals across the lifespan from infant to older age. They administer anesthesia for procedures and surgeries. They can either work alone or work in a team with healthcare providers depending on state laws, or some states that do let you be an independent provider, and other states that you must be under a doctor of anesthesia and unable to practice without their foreseeance. They usually work in the operation room, but anesthesia can be provided in emergency rooms, doctor's offices, and outpatient surgery centers in a sterile environment. Now, how to become a certified registered nurse anesthetist? First of all, you must be a registered nurse, and this role actually requires that you work in a ICU, an intensive care unit, before you can even apply to the program. The minimum is working 1 year in the ICU, but some programs and states require you to work at least 2 years in ICU before you can even apply to the program. You must complete an accredited nurse anesthesia program. And it used to be that it could be in a master's program, but they're actually going away from that. And now they're wanting you to complete a doctorate degree in nursing anesthesia. And then they must pass the national certification examination for nurse anesthetists. So this one is a little bit more rigorous. It can be than the others. It is very competitive to enter. Reimbursements for advanced practice RNs. So Medicare pays APRNs by fee for service as set by the federal government agency. So the APRNs are able to submit a bill with services provided, and Medicare pays depending on what services were provided with a set fee. And each year, Medicare gives providers a list with fee payments. Physicians are paid 85% of whatever the fee is. But Medicare pays the APRNs less than this 85%, and they're really paid based on the discretion of Medicare. The only way that APRNs get the full 85% is if they work directly under a doctor, and it was said by such doctor that this was needed to be done and they were unable to complete it, so the APRN was needed, and it was under a physician discretion and supervision. Relationship challenges in the workplace. So a very common challenge is imposter syndrome. This syndrome often affects APRNs within their jobs, which really hinders them from not being able to reach their full potential. Sometimes the big change from being just a registered nurse to now an advanced practice registered nurse takes a toll on the actual providers, and they feel like they might not be good enough for the role, or they don't know enough. So sometimes they feel like they're being an imposter in their new positions, and which really hinders from being able to provide the best of their ability if they let it affect them too much. Inadequate staffing and increased patient load can lead to fatigue and burnout if they're seeing too many patients and just as in regular nursing, if they're seeing too many patients and they're not having enough time to properly assess, treat, diagnose, write their or do their dictations, write their plan, it might not be enough time, and that burnout might come in. And if they don't feel like they're getting enough support from physicians or their bosses to expand their role into more an independent style of treatment, that might hinder them as well, especially in states where there's not a lot of autonomy for the APRNs. That might put a toll on them if they have to run everything by the doctor and they don't feel like they're independent enough to actually provide for the patients. And if for those working in a hospital setting, if they don't feel like they're getting enough support from administration, if they feel like all the support is going to the physicians and they're kind of on the sidelines, sometimes that can lead to anxiety and feeling of burnout and unwelcomeness. How to overcome issues in the profession. Advocating for better working conditions, practicing self-care, taking the time off, taking the vacation, not answering calls out of work time, and keeping up with continuing education and new technology. And in all these professions, just as in regular nursing and advanced practice nursing, you are going to have to continue with the new technology, with the CEU's continuing education, just stay up to date with all the new medical discoveries because we never stop learning. And also supporting policies for expansion of the practitioner role. Some states are still not independent APRN roles, so you have to work under physicians, and we really want to encourage so that it does open up the doors for these providers in these states that don't see the role as being able to be independent when after the pandemic it's clear that now more than ever we need more independent roles in this country to overcome the growing population, especially the older population. And we don't have enough physicians as providers, and that's where the APRNs come in and we can fill those gaps. And this is my reference list. Thank you very much.